Thank you, Lauren, and I'll try to be as brief as possible. Also, I don't think I stand a chance coming up after what Ashley just did, so I apologize for not being funny. I apologize, I don't have anyone that I can call Sweet Eyes. I do have somebody I can call other things to, but we won't go into that. And so we'll just get on to advocacy, and also I'm gonna trial by error. Oh, there we go, perfect. And I do have notes because I have a horrible memory. As Lauren said, I had 3 cancers, so please forgive me. So I am the advocacy officer of the Melanoma Research Foundation. And first, I just want everyone to give a really big round of applause to Lauren and Sarah for putting this together. And they've done such a great job. I just know that they have meant so much to so many of you over the years, and likewise for them, you hold a special place in both of their hearts, and we are just grateful for you being here with us tonight, so thank you. As I said, I'm the advocacy officer for Melanoma Research Foundation. I joined in 2014, started with the Gala program. I wanted nothing to do with that after a few years, and so now I work in advocacy as a passion. Advocacy is more than just what I'm going to go over today. I just want to put that out there. Today we're going to talk about a little bit about how it is to influence policy and make change within your state on a federal level a little bit. But advocacy is also very important for self-advocacy, and that's meaning exactly what Ashley did. Ashley proved to be a wonderful advocate. She made her voice heard. She got out there. She didn't let people to tell, no, I don't want to hear your story. She told her story. She told it proudly, and she made people aware. And that is one of the #1 things we should be doing in advocacy. So kudos to you for an excellent job. And it's unfortunate that you have to do it, but you're doing a great job getting the word out there. So health advocacy is to facilitate change and the development of new areas of policy in order to tackle unmet health needs or deal with emerging health needs in a given community. This crew right here, we just had an advocacy summit in Hill Day. This crew right here represented over 20, I almost said countries, but 20 states. We had 55 advocates, and they had about over 55 meetings that day with their senators. And I will say, as of yesterday, they were going and asking for $20 million in appropriations funding, which means that we're asking for the Department of Defense to give us $20 million to fund melanoma research of all types. And we've had 25 signatures in result of that. So they did an excellent job, and that's how you can promote change within the Congress. So why do you want to speak up as an advocate? It's because patients and caregivers have a unique perspective of the problems they face. So what this means is that the detail and reality that patients experience are often lost to them. Hearing the constructive views of patients who are experiencing the system firsthand can touch emotions and influence your policymakers. This is the Colorado crew here. We have a couple ocular melanoma survivors in there, and then of course Liz Riley, most of you know her. Her and her son Mercer, who's going to be the next president of the United States, is there. Wow, he really tears at your heartstrings. It's incredible. So again, why speak up again? So rare cancer patients and their family need and want improvements in treatments and the diagnoses. Rare diseases affect 30 million Americans, or 10% of the population. That's 1 in 10 Americans. Only 5% of rare disease have an improved treatment, meaning 95% are without treatment. For eye disorders, including ocular melanoma, there are only 10 medicines currently in development. And as most of you know, Immunocore has a new one that's just been fast-tracked. And that is as a result of not only Immunocore's efforts, but the efforts of doctors and researchers and patients and caregivers such as yourselves who have gone in and given public comment to the FDA about how important it is to have research in rare disease and improve orphan drug medicines. So, and although we've seen incredible advances in the development of medicines to treat patients with rare disease, as researchers uncover the molecular and genomic drivers of many conditions, Rare diseases are biologically complex, and scientists are working hard to uncover underlying causes of the clinical courses of individual rare disease. Biopharmaceutical companies are committed to following the science to develop orphan drugs and have more than 800 projects in clinical development right now. And as Ashley mentioned earlier, research is moving fast and furious. And again, it's because of the advocates across the board. So, believe it or not, policymakers want to help the people they serve, and they can't do this without hearing from you. Change cannot occur without the support of the people. So in the middle there, you see change. So change happens when you share your story. When you share your story as a caregiver or a patient, when you let someone know, just like Ashley said, she turned her eye, someone bumped into her, spilled your coffee. She doesn't know why she can't see you. So change occurs when you politely tell somebody, this is why. We never know what's happening to the people around us. Change occurs when you stand up and represent the people, when you offer support to somebody else who's going through something similar to you, when you educate others, and when you rally for change. So let's talk about what advocates do a bit. So advocates raise awareness. You can educate your community about your rare disease. You can write a letter. You can write a letter to your elected official asking for support. You can attend meetings. You can schedule a meeting. You can just call. They want to hear from you. Your representatives in the state of South Carolina or Nevada, Chad, or Oklahoma. I don't know if anyone's here from Oklahoma or North Carolina, Texas. Okay, got to call out for Texas. But they want to hear from their constituents. They work for you, and they don't know what you're going through unless you reach out, give them a call, give them an email, write a letter. So then again, send emails, and then fundraise. I know we have some ocular melanoma fundraisers in the house here who've done an amazing job over the past 3 years to raise funds for the Melanoma Research Foundation's ocular melanoma program. So thank you for that. But participate and start your own fundraiser to raise awareness and funds to help bring about change. So how can we influence change? That's a couple of our advocates there meeting with Betty McCollum's legislative assistant. They also signed on to that letter. So how do you create change? You want to first figure out what it is that you want to influence. Is it melanoma research funding? Is it access to affordable treatments? Is it access to clinical trials? Or is it just general awareness? Being clear about the policy issue or process that you want to change is the first step to effectively influence legislation or change in government policy. And this is one of my favorite quotes down here. The journey of 1,000 miles begins with one step. And I'm not even going to attempt to pronounce that name because I'm just going to butcher it. We'll call that one Sweet Ice too. So the second key is knowing who you want to influence. Do you want to influence Leslie Snopes from Parks and Rec as a city council member? Do you want to influence somebody in the House or the Senate? I put those gentlemen up there because they're from Virginia and that's where I live. Or do you want to do the committee? So do you want to influence somebody in the Ways and Means Committee or the HHS, so the Health and Human Services Committee? And then you want to know, so for example, if you wanted to find advances in research and development such as regenerative medicine or gene therapy or other targeted therapy for innovations, renewed hope that a treatment could be on the horizon for any disease, no matter how rare. This sense of optimism is, however, tempered by increasing decisions about whether payers, public and private, will be willing and able to pay the high cost of these very specialized treatments. In this case, you would want to influence the change to ensure that stakeholders have adequate time to effectively adapt their business arrangements to ensure that patients actually receive the benefits intended with the proposed rule. So example, there's a proposed rule right out now, and this is what I'm talking about, that is trying to If anyone's heard of like step therapy or the rebate rule, where manufacturers are now looking to give rebates to the pharmacy benefits manager as opposed to the patient. So a lot of those manufacturer grants that help you pay for the medicines that are very expensive in the rare space there is a proposed rule now that is kind of affecting that. So part of advocacy work would be going to the FDA and telling them why it's important to you that you're getting benefits of those rebates to the patient as opposed to being a pharmacy manager. So. And then lastly, let's see what we got going on here. Advocacy in numbers. So it's never just going to be one person's voice is amazing, but you want to share that. So the Melanoma Research Foundation, we have a new tool that is a Take Action Now tool. If you go on and visit our Advocacy Action Center in the next coming month, in May, we'll be rolling out a new website. And with that, we'll be rolling out a new advocacy tool where you'll be able to find such things like making comments on these FDA proposals. You'll be able to find comments about how you can talk to your legislator and send them a letter immediately. With just one click of a button, you'll be able to call or send a video message about 30 seconds, or email or tweet and share with your friends and family about why it's important to you that some of these rules, laws, legislations are passed to benefit your health and your quality of life. Because in advocacy, sharing is truly caring. So don't forget, you want to educate far and wide, because you never know who anyone is going through or what they know that you're going through. You want to engage as many people as you can in order to make change, because advocacy works in numbers. And again, share far and wide, because there are people that want to be there for you and support you. You'll never be alone if you share your story. And you are super. Sharing your story gives you the power to be an advocacy superhero. Your story is important. The people who do make laws, they want to hear it, and they want to know why it's important to you. So thank you very much.